Hey, everyone. Thank you so much for joining us tonight. My name is Tanya Osborne. Some of you know me. I am the Director of Community Engagement and Digital Events with Women Grow and the founder of the Cannabis. And I am so happy to be having this conversation with you today. We are really fortunate to have some fantastic panelists. Women Grow, Leafwell, and Columbia Care are our partners with this event today, where we're going to talk about cannabis for health and wellness in honor of Breast Cancer Awareness Month. That everyone knows that October is Breast Cancer Awareness Month. So we really want to start having these more medical conversations to talk about cannabis as medicine and really make sure that everybody understands and gets all the information that they need. So we've been really lucky to be able to bring you some really fantastic, qualified, educated panelists to have these conversations. So I'm going to bring everybody up and then they will be able to introduce themselves and then we can get our conversation started. So I wanted to start with Dr. Diane Dickinson, who is the medical director at Leafwell. Going to bring up Emily Fisher, who is the CEO and founder of Leafwell. And also wanted to bring up a friend, Stacy Forrett out of Rochester, New York, who is the supervising pharmacist and general manager at Columbia Care. Ladies, thank you so much for joining me today. I'm so thrilled to have you. Wanted to give everyone the opportunity to introduce themselves. If you hear a dog in the background, that's the essence of a live event, So, oh my goodness. So let's start with Emily. Will you take a moment to please introduce yourself?
Yes, thank you so much, Tanya and Women Grow and Columbia Care for having us here today. And it's really a pleasure to be part of the panelists on the show and also to be talking about something that's very dear to my heart. So thank you for putting this event together. My name's Emily. I'm the founder and CEO of Leafwell. Leafwell is a company, a 2-year-old company that set out to increase access to cannabis as medicine. And we do that through our platform. We now operate in 34 states around the country, and we help patients get certified for their medical program so that they can use cannabis and connect with a physician easily and quickly on our platform. We're also really focused on patient education, and in the background, we are gathering research and data on what people are using, how people are using cannabis, so that we can more effectively understand how cannabis can be used as medicine. So thank you again for having me. I'm also a breast cancer survivor, so it's really great to be here to be talking about this. Oh, you're on mute, Tanya.
Yeah, okay, Dr. Diane,
thank you also very much for having me. And I have been in Connecticut for 1.5 years where I work with Leafwell, and I am from New England. It was a move back to New England in the middle of a pandemic. But for 30 years, I was in California, 20 years in Humboldt County. And I've been doing medical cannabis consultations for about 14 years now. In Humboldt County, there was only one doctor doing what's called 215s or medical cannabis certificates, and he really wanted to retire. And he asked me if I would take over, but I had 2 very intense jobs at the time, and I said no. And then I realized that there really was nowhere else for them to go at the time. And so I decided to have 3 jobs. And initially, I learned from patients. I really didn't know much about cannabis. We didn't know anything about CBD at the time. Access was difficult, even though there were dispensaries. And then I started going to conferences and reading and getting smarter and gradually could teach people. And I'm really happy to share my knowledge. And I am also a breast cancer survivor.
Thank you so much, Dr. Diane. And Stacy.
Hi, and thank you for having me. I'm so glad to be part of the panel tonight in this important discussion that there needs to be more of. So this is great, great timing. I've been a pharmacist here with Columbia Care since we opened in Rochester since January 2016. I just in my pharmacy career, I was always looking to specialize into something, and going from every medication basically down to one really fit that bill. And especially something so new and exciting and interesting as cannabis. So that really caught my attention. And it's been great to see the progress that patients have made over time and the changes, in the program here in New York and across the country. And then I also became a medical marijuana patient myself when I was diagnosed with breast cancer. I'm also a 1-year survivor too. So I'm very happy to be here with these lovely ladies tonight.
Thank you so much. So everyone is in for a wonderful conversation. We have some really great questions to get started. So as people start to, with the legalizations that are happening across the country, whether it be medical or adult use, a lot of the conversations and a lot of the spotlight is on cannabis right now because people are curious. The conversations are getting more robust and people are wanting to learn more. So the question is, and I'll ask Dr. Diane first, or actually I'm going to ask Emily first. What advice would you give those that are looking to start using cannabis and to basically for overall health? Or if they already use cannabis and want to be more health focused, what would you tell them? I think you're muted now, Emily.
Here we go.
Okay.
Thanks. I was just saying that I actually get asked this question quite a lot from people all over. So I always tell people to start low and go slow. That's the first piece of advice. And to really be proactive in your approach to treatment as well. I think the way we need to think of using cannabis is different to how we typically think of medicine, where we just take a pill and there's, the exact dosing is given to us and we can be very passive in sort of that process. I think with cannabis, you really want to engage in the process. And as far as we know, we don't know I think that's the bottom line. We don't know what products are going to be most effective for whom. And there are, hundreds and hundreds of new products every single year, depending on where you live. And so navigating that can be really daunting, I think, for someone who's starting out. And I also really want to explain to people that cannabis can't be thought of as just cannabis generically. Actually, what's inside the plant, what's the profile of the product, the cannabinoids, the terpenes, and the way it interacts with our own individual endocannabinoid systems really determine its effect and also your experience of it. Also, the ingestion method as well comes into it. So there are many factors, and this makes it a lot more complex than to the usual experience you'd have taking medication. So I would say to people, educate yourselves. Learn about what are the different ingestion methods, what are the different products out there, and be prepared to try several products. And when you're trying them, keep a diary as well. It's really helpful. Because those differences can be slight and they can be extreme at the same time. They can be extreme as well. And I think it's really important for us to, especially when we're new to it and exploring the different products, to note down what product you're taking, how much you've taken, what time of day you've taken that product, and also what you're feeling, what was your experience like, so that you can go back and start putting together the best treatment plan for you, which, as far as we know, there is some literature and, this dosaging or these sort of profiles might be more effective for this, but we don't, definitively know. And so that would be my advice to anyone thinking of using cannabis as medicine.
Thank you. Because everyone is going to receive cannabis differently. Same dosing, everyone is going to react differently. And based on what you're using it for, it really needs to be a case-by-case situation, Dr. Diane, what is your way to introduce someone into cannabis for wellness or transition a current consumer to using it more medicinally?
I try to make everybody aware of the endocannabinoid system because I think that really puts it in perspective for them. So I start with a little history And Raphael Mechoulam is an amazing gentleman. He's turning 91 in November, and he is still doing and publishing cannabis research. But in 1960, he was a biochemist with a lab, and he decided to try to determine what's in cannabis. And by 1963, he had isolated and determined the molecular structure of CBD in 64 THC. But all we knew was that THC was intoxicating. And then nothing happened for a while. So fast forward 24 years, and a team of 5 scientists did a very interesting experiment. And what they did was they took THC and added a radio tag to it, show up on an X-ray. They injected that into a rat, and they X-rayed the rat. Didn't hurt the rat. And I have a pet rat, so and they thought the whole rat would light up, but it was all in its little brain, and they were mystified. And then they somehow talked a human into doing the same thing. It was all in his brain. So the only reason they could think of is there must be a receptor in the brain grabbing onto the THC and holding it there. So these 5 scientists put that out into the scientific research community, and all the scientists were like, that's not how biology works. We would never make a receptor for a plant molecule. The only way we would have a receptor for a cannabinoid is if we also made a cannabinoid. Just like we make endorphins, which are opiates, that's why we have opiate receptors. That's why pain medicine does anything and people get addicted to narcotics. So the scientists were like, well, we make opiates, maybe we make cannabinoids. So everybody started looking. It took Raphael Mechoulam, I've read different accounts, 2 to 4 years to find the first one. And he got to name it, and he's very sweet. And he had a gentleman in his lab at the time that was studying Sanskrit. So anandamide with Ananda for bliss. And at this point, where we're at is there are 2 very thoroughly studied cannabinoids that we make, and there are more being looked at. And there are 2 very thoroughly studied cannabinoid receptors in our body, not very creatively named, CB1 and CB2 for cannabinoid 1 and cannabinoid 2. And between the 2, there's lots of overlap. There is no organ in every single organ in your body, your bone marrow, your lymph nodes, your immune system, your skin, everything has receptors. And it's the largest receptor system in our body. I have doctor friends that go, oh, how can anything help migraines and PTSD and seizures? It's because of this receptor system. And the last poll I saw, which maybe it's improved, I hope, was 9%. Only 9% of medical schools are teaching that. So I always start with the endocannabinoid system, and then we go into products and their ailments. Oh. And now I think you're muted.
I keep muting because I want to keep my dog at bay. But that I've never heard the history of the endocannabinoid system, so I really appreciate that. And one of our commenters said that most people aren't even aware that humans have an endocannabinoid system.
And one more thing, every animal they've looked at has this except crustaceans and insects. So like in California, the dispensaries carry products for pets. In Connecticut, I don't think they do yet. I haven't heard that they do yet. But
and in dispensary, no, but I've seen many CBD brands that do carry pet products. Mm-hmm. So thank you so much for that. Dr. Stacy, what is your input on introducing somebody to cannabis for medicinal purposes or the transition from consumer to medicinal use?
Well, that could be a really long answer. I guess the short version is sort of kind of threefold, to kind of echo what Emily said, to start low and go slow. This isn't like a one size fits all medication. And part of the great thing about cannabis is that you can really tailor the treatment to a specific person's needs. But that just means there's a lot more options and maybe more time to go through it. So you have to commit to it. It's not, miracle marijuana, it's medical marijuana. So, it can take time for someone to work up to the right dose, to avoid side effects, to find what route, what ratio, what strain, which cannabinoids and terpene combinations work best for them. So there really is this trial and error process to it. And then to do your homework, before you take any product, no matter what it is, whether it's an over-the-counter CBD product or a medicinal product with THC, to know where it comes from. How is it made? Is it third-party lab tested? Do they offer COAs? How it's made really affects the type of things that could be in the final product besides just, the potency of the product itself. So doing your homework, and then also, talk to your providers. It should be a medicine, not a secret. So part of destigmatizing it is to ask questions. Ask people that that use it. Ask your doctor, ask your pharmacist. There's a chance for interactions with other medications. Just because it's natural doesn't mean it's, completely without side effects. So, the more people talk to their doctors about it, the more the doctors will, do their duty to be informed too, to be able to help their patients the best way they can.
Stacy, could you just say what COA is for people?
Sure. Certification of authenticity. So basically paperwork from a lab that says, how much active ingredient is in it. And that, from one, bottle to the next, that medication is consistent, that there aren't, just as important as knowing what's in your product and knowing what you're getting every time is knowing what's not in it. That there isn't the presence of pesticides or heavy metals or contaminants or anything like that, because cannabis is a very bioaccumulative type of plant. So whatever media it's grown in, if there's heavy metals in the, soil, it'll uptake that into the plant. And knowing how it's made, different extraction methods can leave different things in the final product as well. So knowing how it's made, where it's grown, what it comes from. And these tests that the labs do can show all of that from one lot to the next, so you know what you're getting.
Perfect. Thank you so much. So wanted to just move on to our next question. What are some ailments? I'm going to actually continue with Stacy. What are some ailments or conditions that women typically come to you curious that if cannabis would be a good fit?
Sure. So you could say like any type of pain condition, things that maybe are specific to women in general, like PCOS, endometriosis, pelvic inflammatory disease, just regular monthly menstrual cramps. That could be debilitating for some people. And they don't want to take the NSAIDs and have the upset stomach of that over the counter. They don't want to go down the road of opiates, and have the side effects of those and, the withdrawal symptoms and the addiction of that. Even more sort of anecdotally, people have used it for menopause. So, for hot flashes and night sweats, we've had some people say that, it provides relief there. So those are some of the more, sort of women specific things, but just even more general terms for sort of health and wellness, athletes use it too. So athletes can use it sort of to help with recovery, to help, balance their system out, to help, with muscle inflammation and soreness and things like that, to keep them in top shape as well.
Fantastic. And how about you, Dr. Diane?
All of the above. And one very nice thing in Humboldt County was there was one dispensary that made vaginal suppositories. So for endometriosis, people just swore by those, especially when their monthly cramps were very intense due to endometriosis or just for menstrual cramps. So that was very effective. And all of the above.
And I think in New York, if I'm not mistaken, we do have suppositories, if I'm not mistaken.
So yeah, that's one of the approved dosage forms in New York. We've had a sort of dual use suppository. So it could be used vaginally or rectally. And a lot of patients, they had them in different ratios, a high THC and equal and a high CBD ratio. So patients with, if they have Crohn's disease, they could use it. If they have, menstrual cramps, they could use it. I've even seen, in some other states too, for sort of more intimate use, they've made cannabis products as well.
Mm-hmm.
So it runs the gamut. Any type of person could be a cannabis user.
Yeah, and just to add to that, I mean, this is not sort of women specific, but what we've seen through the people that are using our platform, and this is, more generally, women and men are likely to use it for things like insomnia, depression, anxiety, headaches, nausea, vomiting, and PTSD as well. So I just
Absolutely.
wanted to add that because we get a lot of patients.
Okay, great. Thank you. Thank you. So the next question is, can you share some advice about other things we can incorporate into our lifestyles to increase our health on a day-to-day basis? And I'll start with Diane. Let's start with you.
If people have the time and energy to listen to me, I would talk to them about mindfulness meditation, doing that. I think that's just really important. Being active to the best of your ability. Not everybody can go for a walk, but everybody can do something. And general wellness, I'd say my most common comment or question when I have an elderly new patient is, I don't want to feel it, I don't want to smoke. And that's totally doable. And so if a lot of my patients will use a tincture under the tongue like 2 or 3 times a day just to balance everything out. I heard one description of the endocannabinoid system years ago that I love, and it was, think of it like an orchestra conductor that's all day, every day, monitoring all of your physiology and going, okay, a little bit more drum, a little less trombone, and trying to keep it in balance. So if you augment your own endocannabinoids with some plant cannabinoids, it can really help in every form of wellness, in my opinion.
Thank you so much, doctor. I actually just started meditating like last week.
Okay.
I have to tell you, it's a game changer. Like, it's a game changer. I'm still learning because it's only been like a week plus. So, but I'm committed to this. Like, I'm committed to this. Thank you, doctor. Stacy, how about you? What's your input here? What other things can people do for their health and wellness?
Yeah, I would completely agree with Diane that meditation, yoga, tai chi, breathing exercises, all of that teaches you to listen to your own body. And that is what can really inform you to what's working or not working with treatment, whether it's using CBD or using medical cannabis more intensely, in addition to all the other things that you're doing in a day. And just being open with it, that it's a medicine. Plant-based medicine isn't something that's new. We have lots of medications that are based off of that. We have chemotherapy drugs that are based off of that, diabetes drugs, all sorts of things, blood or heart medications. So listen to your body and just be open with your providers, and just like you would list every supplement that you take when you fill out a medication form at your doctor's office, this should be in your med list so that it's normalized.
Perfect. Yes, my doctors do know. So I'm out of the cannabis closet completely, because it makes a difference, because I want my doctors to know my full health range. And I mean, and I think that's how we kind of push doctors into, the more people say I consume cannabis, whether it be medicinally or, for adult use, the more people see that, the more they're going to need to learn. You know what I mean? Because I think Dr. Diane said that only less than 10% of schools are teaching this stuff. And these are conversations that I think patients are going to have to lead that charge, because then how are we going to know?
May I just comment on that?
Yes, please.
Even in Humboldt County, California, where one would think that all doctors are used to cannabis, my patients, I just want to say this, you do have to be careful with some doctors. I have had patients cut off from 160 milligrams of OxyContin a day to 0 the next day, because their they said they use medical cannabis. So I agree. People need to know this and get educated. And as a result, I did grand rounds, which is a lecture to doctors. But unfortunately, more nurses came than doctors, which is lovely. But I wish more doctors were there. But just
I appreciate that.
judge your
right.
doctor.
You're absolutely right. Thank you.
Yeah, we get a lot of requests just for information from providers or provider groups or hospital systems. They're like, how do we incorporate this into it? Who possesses it? Who can give it? What forms do you have? And trying to work it into their normal regimented evidence-based medicine that has been stuffed down their throats for years. How do we add this in now? And it's really a learning curve and an adjustment for people to make. So I totally understand that. I've had the same thing, patients call up and they're like, oh, with doctors like so concerned now over liability of prescribing opiates, like, oh, you have 2 weeks to have your dose and then 2 weeks after that you're off. And people are scared just the idea that they're not going to have it. And we've had people cut off, and I've had lots of conversation with doctors saying, like, this doesn't work like opiates do. You don't need Narcan for medicine like this. It is perfectly legal for a patient to be on Vicodin and cannabis. There's no law that says you can't be on both. Right. And that's part of, a patient having easier access to cannabis now, like through places like Leafwell, to be able to get the help that they need. And instead of being stonewalled when they talk to maybe one doctor who just doesn't understand it, so doesn't buy into it.
Absolutely.
Yeah. And Stacy, just to that point, actually, that was one of the, so I started working in the industry in 2016 with cannabis clinics in California. And it was just an incredible experience. The sort of learning curve and the education of working directly with patients was just one of the best experiences of my life. And you realize how much this plant is helping different people. But it also exposed me to some of the real pain points and some of the real struggles patients had when wanting to explore cannabis as medicine, and finding a doctor who'd be open enough to sort of speak to them about this, let alone a knowledgeable doctor, was a real struggle. And so that was one of the things we wanted to address. And luckily we work with incredible doctors like Dr. Dickinson, and thankfully I think more and more physicians and healthcare providers are interested in this space and in educating themselves. But we have a long way to go. And so yes, I think this is an important topic, and I think also the public want to hear from doctors as much as it's powerful to hear from patients. And for me to share my story as a patient, there's that intrinsic trust between you and a doctor, or the general public and a doctor. So I would urge doctors to educate themselves. That they're busy people, but if you have this wealth of knowledge which you can apply or layer on the sort of cannabis knowledge that you learn, I think it's much needed.
Absolutely. We definitely need education. I've even known some of our cannabis doctors to call traditional doctors to help them coach them through, because the patient was so needing and was afraid, like Dr. Diane said, they were afraid. They were just, and they had the cannabis doctor talk to the traditional doctor, and they have a little powwow, and it's for the patient. If you're here for the patient, that's a conversation that we all need to have. So thank you. So let's circle to the topic of our event is obviously Honor of Breast Cancer Awareness Month. I did not know prior to our call that all three of our panelists are breast cancer survivors, which is incredible. Thank you so much. Thank you so much for being here and sharing your story. So when it comes to breast cancer, can you talk a little bit about what women can do to ensure early detection? And let's start with Stacy.
Well, I'd say, following doctor recommendations as far as screening procedures, doing your monthly self-breast exam goes a long way. I was diagnosed before I was 40. I had a fibroadenoma early on that was benign, but mine was caught on a mammogram. So it was it was caught early, which was great, but those screenings go a long way as far as, preventive medicine. So, do what you can for yourself, follow the routines as far as screening go. And, if you end up with that type of diagnosis, then you shift gears, and there's a lot of approaches, to treatment.
Great. Thank you. Diane, how about you? What did you talk about early detection?
I actually reviewed yesterday the organizations that make recommendations just to see if there was a consensus, and there is not. Like the American Cancer Society and the U.S. Preventative Task Force will have a little bit different age cutoffs and age to start mammograms. A lot of the groups are saying don't start till 45 because below 45 you have more dense breasts and mammograms are not quite as accurate. But once again, Stacy was younger than 45. So I think it's important to talk to whoever your primary care provider is and look at your risk factors. And there is a BRCA gene, which it stands for BR for breast and CA for cancer. So BRCA gene. And if you have a family history, it's worth getting that test. I had a lot of patients over the years that said, I'm never getting a mammogram. I have no family history. Depending on the study you look at, it's 85 to 90% of women who develop breast cancer have no family history. It's just that if you have a family history, you're at higher risk. I have no family history, and my breast cancer was found just in May on a mammogram, which was delayed because of the pandemic, but found in time. And so I've tried very hard to talk people into mammograms. And unfortunately, there's a lot of misinformation about mammograms. The amount of radiation is minuscule. You get so much more flying cross country from the sun radiation. I mean, really, it's tiny. And it's so important. And I had a lump. It was nothing I could feel. I would never have known.
Wow. So yes, so get your mammograms. Follow up with your doctor if you have. Emily, do you want to chime in?
Yeah, I mean, I'll sort of provide my own personal experience. I was diagnosed at 26. I'm 37 now, so it was a while ago. I was very young. I have no history of breast cancer. I just felt a lump, and I went to the doctor twice, and they told me it's probably nothing. Don't worry, it's going to go away in a month or two. You sometimes get these sort of lumps. And luckily, I think more than anything, it was sort of towards the end of the year, and things just always quieten down for me at the end of the year, sort of the time I sort of do my admin. And so I made sure to go back to the doctor, and then they did a biopsy and discovered it was cancerous. And then I ended up having radiotherapy and several operations, actually. So I would just say again, I guess earlier I said to be proactive with health. I really believe in that. I think it's great. More and more people are interested in health and wellness. It's a huge passion of mine. I'm constantly educating myself and finding ways to do that. But yeah, get to know your body. Make sure you check, and everything that Diane and Stacy said.
Because prior to, if there's an eligibility issue with getting a mammogram, there is a self-breast check that you could do. I know there's videos with the arm over the head. I mean, is that how you found your lump, or was it somewhere where you were able to
I was in the shower. I was just in the shower, and I mean, luckily, I think it was fairly close to the surface. Luckily, I felt it, but I would definitely, I check now, and I definitely recommend.
Right. Because prior, I started early with mammograms as well. I have cancer in my family. So I was just like extra cautious, and I'm a little annoying. So they were like, just give her the thing. But self checks are also really, really important. So thank you for sharing. So if, God forbid, you were to get a diagnosis, what should someone do as far as how can cannabis help with that breast cancer or cancer diagnosis? I'll start with Diane.
Well, definitely for any treatment, for pain of surgery, for nausea of chemotherapy, for discomfort of radiation, anything, it will definitely help people. But there's 4 things I'd like to tell you about cancer and cannabis. One is that both THC and CBD induce something called apoptosis, and that is programmed cell death. Every cell in our body has programmed cell death. Nothing lives forever. Red blood cells live for 90 days. Some neurons live for decades, and some cells live for days. But nobody lives forever. Cancer cells do not have that built in. So they both induce this programmed cell death, so that only affects cancer cells. Our own cells already have that. Secondly, there are studies that are showing that CBD and THC inhibit spread, metastases, spread to other organs. So thirdly, there is a gene that was first found in breast cancer patients, but has since been found in other cancers. And it's called the ID1 gene. And if that is active in a cancer, the cancer tends to be more aggressive. CBD inhibits that. Another thing CBD inhibits is angiogenesis, which is making new blood vessels. We don't normally need to make new blood vessels very often, but cancer really wants to, because it's going to bring more nutrition and oxygen and it can grow faster. So inhibiting that is a great thing. I will say that there is controversy if people are treated with immunotherapy. For some of the more difficult cancers to treat, like triple negative breast cancer, where there are not receptors that respond to treatment, are often treated with immunotherapy. On those, I would talk to somebody in the know about it, but they might want to go more gingerly with their doses. And can anybody, any doctor, anyone tell you what the dose is for breast cancer? No. I wish I could go back in time and clone myself, like 20 years ago, and have one of me use cannabis all the time and one of me not, and then see, what was the difference? Because my cancer was extensive. It was throughout my breast, but it was stage 0. And I live in Connecticut now. I am not a medical cannabis patient in Connecticut, but I was in California for years because I had spine surgeries. And so maybe it was stage 0 because of that. Who knows? But we don't know high dose, low dose. We just don't have enough information yet.
Stacy?
Yeah, I completely agree. There is some controversy over using it as a treatment. In New York, it started with certain qualifying conditions that you had to have, and cancer was certainly one of them. But we do have better evidence for using it for all the side effects of treatment. Like Diane said, for everything from like the anxiety and sleep, because there's a lot of pain involved with cancer treatment, whether it's bone, muscle, joint, and then, appetite stimulation, the nausea and vomiting from chemotherapy. So again, because you're going through so many changes at once and you're, kind of inundating the body with this therapy, as to stick with that, start low and go slow approach. But at the same time, if you are using it during treatment, to be open about it, because it can be used in conjunction with other medications. It can be used instead of other medications, just to make sure that your providers know everything that you're doing. Because there are interactions with other medicines. Usually the way that cannabis will interact with another medicine is it affects enzymes in the liver. So cannabis goes to the liver and gets processed by the liver before it gets distributed into your bloodstream. And it depends on how you take it, whether or not it does that. But other medications get processed by the liver as well. And it can usually affect the way your body clears a medication. Like, it can slow that process down, so it can raise the levels in your system and put you more at risk for side effects. Or it can make your body clear that drug faster so that you're not getting the benefit of that medicine. So it depends, what you're on, what you're taking. If it's high THC or CBD, they can have different interactions with different medications. But a lot of people do use different products at different times, different dosage forms. If you can't, swallow or keep food down, maybe an inhalation method is better, or something like a tincture than something oral. You can use something longer acting for pain with something shorter acting for breakthrough pain if needed. Something during the day, something else at night, something for pain, something for neuropathy, something to calm your nerves when you have to have that horrible breast MRI when you're on your stomach with your arms out like Superman. There's a lot, that goes into chemotherapy and radiation and that whole treatment process physically and emotionally. And cannabis can help in a number of ways with that.
Fantastic. So this would be a perfect opportunity for your cannabis doctor and your oncologist to really have a conversation about your treatment.
Mm-hmm.
Because in this case, almost more so than any, this is when they really need to have a meeting of the minds if this is going to be, because what brought me to this industry was my uncle, who had lung cancer, prostate cancer, all the cancers. He had all the cancers. And he lived for 20 plus years with cancer. He went through traditional treatments, but supplemented for the side effects of treatment with cannabis. When he passed, the doctors were like, he just looks like he's taking a nap. He was fat and happy, one of his doctors said. He was always just chubby and happy. And I will always attribute that to his cannabis use. He slept well, he ate well, and that helped support him. But his doctors all knew that, because he was a veteran, he was a former police officer, he had no hair on his tongue. He told people what he was doing, and that really allowed them to really work with him. And I think that it stretched his life, his cannabis use, and that's what kept me here. So thank you so much. Emily, would you like to share anything as far as your input?
I really think Diane and Stacy covered everything, but what I'll share is maybe a personal story. So I didn't actually start using cannabis till years after I'd gone through cancer treatment. And I had, because of my cancer, I had several, I think about 13 or 14 different operations for several years. It was sort of an average of 2 operations a year, and was on a lot of painkillers. And for anyone who's been on lots of painkillers for, a long period of time, there's lots of unwanted and unpleasant side effects of that. So so I used cannabis, ended up using cannabis as a way to manage that pain. And it's just so much more gentle on the body and really effective. But the story I want to tell is actually the first time that I used cannabis. I ended up in hospital and was on some really strong, in the cannabis industry by now, is on some really strong painkillers, Dilaudid, which is a morphine-based painkiller, in hospital. And they wouldn't give me any more, and I was in a lot of pain. So I had remembered that I bought some cannabis and had a tincture in my bag. And so I took that tincture, hoping it would help. And within 5 minutes, I felt that it was helping my pain. So I ended up drinking the whole bottle, and my pain completely subsided. And it went from a 10 with me sort of begging for some more morphine to almost nothing, maybe a 1, if not a 0, for not 1 or 2 days, but 3 days. So I didn't feel any pain. I didn't even need sort of paracetamol or Advil or, whatever you call it. But then the pain started coming back, and I went to the dispensary at this point. I'd left the hospital, and I went and bought more products, more tinctures, used them. Wasn't helping, and the pain was getting worse and worse, and I really didn't want to go back onto sort of the usual painkillers. So I went back to the dispensary, bought more, and this time bought an edible, thinking this is potent, this is going to get rid of that pain. And I took it, and an hour later I was literally I didn't know where I was walking the walls, and I was just I had the worst night of my life, and ended up over the toilet, vomiting all night long. And so I guess that's it's not quite answering your question, but I just wanted to give you my personal experience. I think it just really emphasizes what the others have been saying, which is it's really individualized and it's an extremely versatile. So we say at Leafwell, it's a pharmacy in a plant. It's an extremely versatile medicine, and that it isn't a magic pill, but we've spoken about some of the possible things it's not it may not be as effective for, but it's an extremely versatile medicine, and I think my experience just shows that it's important to really sort of take it slowly and listen to your body and try different things.
Thank you so much.
Yeah.
May I just add
I would definitely get Stacy, when you mentioned how cannabis bypasses the liver, how does it do that when it doesn't go that? How do you consume cannabis and it not go through your liver or kidneys?
Sure. Yeah, so anything you take orally, anything that gets ingested through the GI tract, is that blood supply goes from the GI tract and then that feeds into the liver before it gets distributed to the bloodstream. So anything like an edible, anything you take orally will go that route. To not do that, then you inhale it. You can use a tincture. If it's absorbed sublingually, like through the oral mucosa, you get more out of the medicine and faster than something you take orally. A suppository is going to bypass that too. So different dosage forms of the exact same medication of the exact same strength can have different effects on a person just because of the way you ingest it, the timing in your system, how long it lasts, how strongly you feel it, whether or not you ate it with food or not, or what type of food can matter depending on how you're taking it. So again, just back to there's so many options of this, just one tool in the toolbox.
Right.
But yeah, a lot of times there aren't as bad side effects with a medicine like this, but it's more effective than a lot of other medications. So a lot of patients have been able to transition from other medications. A lot of patients on opiates for pain control, and not as much hard data, but a lot anecdotally we've seen that it also helps with that withdrawal effect of people who have been trying to get off opiates for years. Not only is it helping with their withdrawal, but it's also giving them better pain control. So we've seen people that have been able to come off, I'm off this opiate and now I'm taking, only a couple of times a week, and their doctors are high-fiving them and they're so glad, but maybe they're still not the ones certifying them for it.
Right. Absolutely.
So it is still an evolution, and the more education of the correct information, the better. But yeah, just, again, trial and error, and different medicines in the body have different metabolites and can affect people different ways.
Thank you. Dr. Diane, what were you going to say? I'm sorry I interrupted you.
Oh, that's okay. I just wanted to say that there have been several studies that show that for pain, particularly neuropathic pain, like when a nerve is squished in your back, for instance, a 1-to-1 balanced ratio can work best. Everybody's different, once again, though. And for my patients that are cannabis naive, they don't have any tolerance, I will have them use 1-to-1 if pain is their main problem, but one drop under the tongue. I mean, tiny, like the start low and goes low. And the other thing I educate people about is when you combine an opiate, say somebody's on hydrocodone 3 times a day, if they use cannabis at the same time in any form, that it doubles the pain relief. More than doubles, like it goes, instead of to 2, it'll go to 4 or 5 for most people. And then the patients are able to space out their medications and use less. And I do want to add, I don't want people to be afraid to use cannabis with medications. The only medication I have seen where you have to be very cautious because of the metabolism in the liver is children with seizures, where if they're on many medications for seizure control, those need to be monitored and lowered as they increase their cannabis. But it really augments many, 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 many medications like antidepressants.
Awesome. Thank you so much. So I guess the next question is as people, let's say you were either cannabis naive, as you said. I love that phrase. Or in the cannabis closet, as I like to call it, and you are now you really want to start using cannabis as medicine or learn more about cannabis, and you want to have conversations with the people that you know and love, so the question is what advice could you give those people who want to talk to family and peers about their cannabis use, whether it's a part of their treatment plan or general health and wellness? We work really hard to fight the stigma of cannabis. People are more welcoming of it, I think, when it's in a medicinal vantage point. But that's one step to the next step. What would you tell someone who is new or choosing to come forward with their cannabis consumption? I'm going to actually start with Emily.
Thanks, Tanya. So, we also get asked this quite a lot, and like everyone on this panel, Leafwell are working to destigmatize the plant and educate local communities, educate people, and we're always looking at evidence-based information. I think it's so important to provide people with reliable information that they can trust, that's sourced, and that's medically reviewed. And so I would always, although there's a lot of research that still needs to be done, there has been, I would say, a huge increase in really great content, medically or evidence-based content. And I would say speak to your loved ones and show them the evidence behind how and why cannabis is helping as a medicine. I would start there. And of course we have, there is thousands and thousands of anecdotal, evidence, but there is a growing body of evidence on why cannabis helps. Certainly on our website, we break down all the, the different parts of the body, the different conditions, and you can look at how cannabis helps for a specific condition, what the research currently says, what studies have been done, how much of them have been shown to be positive, negative, or inconclusive. So we do really sort of provide that information. There's some other really great resources out there. So I would urge people to look at those resources and share that with their families. And that's been helpful for me and I think for many people I've spoken to.
Thank you. Stacy?
Well, I would say it depends on your ultimate goal. If you wanted to start with just an over-the-counter CBD medication, just to know that you're using a good, solid product. If you're going for more of a medical product, you can always just say, "Oh, this is recommended by my doctor." And a lot of it, talking to friends and family just comes down to terminology. If you just say, "Oh, someone's a marijuana user," that doesn't sound so good. Or, "Oh my gosh, if you use the word weed, that's just a 4-letter word." But you say, "Oh, I'm using like a hemp product." That sounds really benign. It's all under this cannabis umbrella. You have marijuana and you have hemp, but it's all cannabis. So a lot of times it's using the right words. People are more receptive to cannabis than they are to the words marijuana, just because the connotation and the stigma. But, you can start with a hemp-based product, like an over-the-counter CBD, and you can dabble in that first if you want. You can seek out a doctor and get a medical certification, and if you're an adult use market, to try something with, THC and CBD, it can make the THC more tolerable. And like Diane said, starting with something like a tincture, that's a really good way for people to ease into it, young or old, to just something you can take a drop of. You can really adjust the dose and slowly work your way up to the most effective dose for you.
Right.
But it's also adjustable. Like when you're on an opiate, your body requires that same dose every day, whether your pain level requires it or not. But something like cannabis, you can adjust up and down on a daily basis based on what your needs are. So it's really flexible, which is nice.
So when I talk to people about that, I usually send them things like, there's a great film that was produced by Ricky Lake called Weed the People. I say, watch this movie, or I forget, Mary Jane Films did a film about women in cannabis. I'm like, watch this movie, because sometimes people don't want to hear from you, the consumer, because they know you as how they know you. And however that could be good, bad, or indifferent. So I think putting people in front of, find a medical study and share it with a family member, that those types of things when you're trying to introduce people to cannabis, not for themselves, but saying, listen, this is what I'm doing to take care of my health. And I just want, I don't need your okay, but I want you to understand that this is what I'm doing. You know what I mean? Like, I have a 14-year-old son, and I am not a medical patient, but I'm a consumer. Um, Funny thing, when my son went to high school, he came to me really serious. He was like, Mom, is weed cannabis? Because I never used that phrase. So when you said it, I was like, yes, it's the same thing. And then I was like, what are you talking about? Who's talking about that in school? But that was a whole other conversation. But it's just, I think when you're open, when you're honest, I'm not asking for your approval, but I am asking for your, to be open-minded and not shame me or not give me your own stigmatic beliefs about what I'm doing for my health. And I think that that's always a great way to start, So I don't want to go too long, but I definitely want to hit our last question was, are there any companies focused on women's health in the cannabis space or products that are specifically helpful for conditions that affect women? I would say, Dr. Diane, do you have anything for us?
I don't have any real specifics because I use the same things with both. Although in California there is a lubricant that's, and I honestly do not know the specifics of it, but for sex, and I have patients that love it, and so it obviously does some things. And I just wanted to add to that last thing. I've had some people who were totally against cannabis and totally closed-minded open their minds because they see the improved life of their loved ones. I've also had patients whose family will not talk to them anymore. So I think patients really need to judge, okay, what is their goal and what are they looking for from that conversation and before they have it. And
yes, good
yeah.
point. Good point. Stacy, any recommendations for any products that would be fitting for women?
Yeah, I guess it depends on, what you're treating, because there's quite a long list that you could use it for. But, like Diane said, the suppositories, are more specific for certain women conditions. Even if you're undergoing radiation therapy with, involved with breast cancer or any radiation therapy for any type of cancer, I suppose. There's a lot of topicals that have been used that patients have like really great results with. Because there can be some pretty uncomfortable side effects associated with that as well. Topicals for just even like in recovery now, being on hormone blockers, I have medicine that causes a lot of joint pain, and I use like a topical for joint pain, and that's just related to my cancer treatment. And then topicals for menstrual cramps, even, that could be used as well. So it all depends on, I guess, what you're looking to treat. And I'm sure there's something, that we could tailor. Basically.
Emily?
Yeah, no, I agree. I think it comes down to what you want to treat. A personal favorite of mine are the Aunt Zelda's line of products. I think they're super high quality, and I particularly love their balm, their topical for the face. I think it's fantastic. But there are so many great products out there, and yeah, as Stacy said, it's really down to what you want your desired outcome.
Fantastic. And I am not a huge product person, but what I always suggest strongly is for people to learn how to take their dispensary grade product and make products that they enjoy. I am a big fan of of the Arden to make butter and oil. You know, I'm a big fan of learning. I've been learning how to make suppositories. It's work, you know, I'm having fun learning how to make my own products. And I think that everyone should give it a shot. I mean, why not learn how to make some infused butters or oils that you could use, make your own stuff? You know, some of these products are expensive, you know, so okay, so I did want to share. I want to thank Emily and Diane for this offer. If you want to get certified as a medical patient, this conversation is a national conversation, but I know most of us are on the East Coast. I think Emily, are you in the UK? Or are you here?
I'm in New York right now.
Okay. So that if you wanted to get your medical card, you could visit leafwell.com. I'm going to put up an infographic in a second and enter the code October 21, and you'll get 25% off of your certification. I'll actually put a little infographic up so that everyone can see that. We are definitely going to be continuing to have more conversations in the medical arena because we definitely feel it's important. I know Women Grow is a company that focuses on entrepreneurs in the space, but in reality, most of those entrepreneurs are women, which means they have families, they are parents, they, you know, patients, what have you. I'm a caregiver here in New York State. So we want to continue these conversations. I really want to thank everyone for participating. I want you to just kind of give us, as we wrap up, like your 1 minute close, telling people, obviously, if you have the ability to become a patient, obviously with the new legalization for adult use. We don't have it yet. You know, in the tri-state area, it's not here yet. Even though it's here, it's not here yet. The only way to access legal cannabis in the tri-state area right now is through the medical program. So if you qualify for a card and would like a card, Leafwell is extending a fantastic offer, and we want to thank you for that. So circling back, Stacy, can you give us your little 1 minute wrap up, and then we can start closing out the night?
Sure. Well, I guess, thank you for having me too. This is great, a great experience. And I just say, do your homework, know what products you're taking, where it comes from, anything that you put in your body, you should know what it's supposed to do, what it's not supposed to do. And then, you sometimes with to get the most out of it, you do need to commit to it. Some of these medications do accumulate in the body over time. So to see the full effects, you do need to be on it for a little bit of time. So, don't give up. Just stick with it and try different products and try different doses until you find out what works best for you.
Thank you. Diane?
I guess over 14 years, I have seen a lot and a benefit in patients. And I really have seen people being more productive, more creative, more joyful, more involved in their lives and their families' lives. And I just want to add one thing about pain. A lot of my patients describe this, and I would agree personally that it's very different than taking an opiate. Opiates block the message to your brain. Cannabis works differently. And a lot of my patients would say, if I take it for my back pain and I take my mind and I go, oh, yeah, the back pain's still there, but I feel better. It's not in your face. It allows you to do other things and put those disconcerting symptoms aside.
Thank you. Thank you. Emily?
Yeah, so firstly, just a huge thank you. It's really been so lovely to be part of this conversation. And thank you to Stacy and Diane and for Women's Grow for putting on the event. I'm really excited about cannabis as a medicine because I think, as we all should, start thinking about health holistically. Health is not just one thing. It's not just it's not just not being ill or being well. It's it's sort of mentally, emotionally, etc. And I think cannabis is extremely versatile. It works with us, as far as we know, on an individual level. And so I think we've said it several times in this webinar, but I think people who are starting out trying this should be up for should realize that they may need to try various different products and understand how it works individually with their own bodies and their own endocannabinoid systems to find the right dosage, the right regime, the right care plan that's effective for you. And but I think that process is actually how we should be thinking about health overall. So yeah, I'm excited about the future of cannabis. I think it's going to be increasingly part of people's health and wellness regimes. I hope so. And I know there's a lot of people out there who are interested in using cannabis who haven't tried it yet. And so I guess my final thing is start low and go slow.
Start low and go slow. I co-sign with that 100%. Thank you, everyone, for joining us. Thank you, Leafwell. Thank you, Columbia Care. Thank you, Women Grow. Thank you, our audience, for joining us. We will see you very shortly. We have some really great programming coming up. I will close with our little exit, but I will also leave the info for the call to action, where if you did want to get your medical card, there's a lovely offer from Leafwell to take advantage of that. And I would say take advantage of that. All right, everyone, have a great evening, and we will see you very shortly.
Thank you.